It is estimated that 14% of youth from 10 to 19 years old globally experience mental health conditions. That push the AUC to exert more effort to support students' mental health through initiatives, strategies, and discussion events. That raises a question. How do AUC students feel about the causes of their mental health issues?
يعني هو actually هم ليهم two sides. أول حاجة البيرسونال سايد، بحس إن دايماً family بيبقى ليهم impact كبير على الشخصيات وإزاي الناس بتتعامل مع مشاكلها، أو إيه أصلاً بتبقى دايماً غالباً بيبقى الأهالي بيبقى ليهم إيد كبيرة في المشاكل اللي بتحصل. ده أول حاجة. تاني حاجة بشوف إنه declaration بلس إنه الauthority of البروفيسورز على الجريدز بتاعتنا ساعات بحس إن هي ليها سبب كبير قوي في المنتل هيلث ايشوز دي، لانه ساعات بحس انه انا دايما في كومبيتيشن ان انا لازم اجيب هاي جريدز عشان ديكلاريشن، وحتى بعد ما بخلص يعني يوجولي في ناس بعد ما بتخلص ديكلاريشن اللي هو خلاص ما بيبقاش فارق لها، وفي ناس ثانيه اللي هو لا اصلا لازم اجرادويت بهاي اونرز او هايست اونر.
Students suffer from anxiety. It's common في population in general, not only AUC students, generally in any population. Anxiety is common, and social anxiety, test anxiety, general anxiety, it's common. Also adjustment with the university lifestyle, adjustment with the academic workload. Depression is also one of the common complaints.
To empower students in front of these problems, that's why a Center of Student Wellbeing was established.
We have 4 main services or units that come out of the center. The first important unit is the mental health counseling unit. This unit actually caters to students who have any emotional or social problems. It could be simple things like building skills in terms of anxiety or studying habits, all the way to more pathological issues such as depression, anxiety, or adjustment to AUC or the culture for international students. The unit also deals with all emergencies that happen on campus related to mental health. The second unit is student accessibility services, which was formerly known as disability services, but we shifted away from the term disability to reduce stigma associated with this term. Actually, this unit is responsible for providing academic accommodations for students. These accommodations are sent to faculty, and according to the AUC disability policy, faculty need to abide by these accommodations. They could be testing accommodations or classroom accommodations. The unit also makes sure that the campus is accessible for students, especially during events that happen on campus as well. The third unit is the academic risk counseling unit. Basically, this unit caters to students who are on probation or at risk of being on probation, which means GPAs less than 2 or GPAs 2 to 2.3. We try to reach out to all these students, meet with them, try to find out what the problem is, what the underlying issue is, and address that accordingly. So if it's a mental health issue, they continue within the center with mental health counseling appointments. If it's academic-based issues, then we refer them to the peer tutoring center where they can get help in certain courses.
The center psychologists also pay attention to current events that may affect some students.
One of the support groups we recently offered was to the Libyan students who have been affected by the Daniel storm, and their families have been affected.
Many activities are launched by the center that may need more shedding light on.
ان في هنا mental health center في الجامعه، ان انا مره I tried to book فيه بس it was fully booked for تقريبا شهر قدام، فكنتش هستنى شهر عشان احل مشكلتي. يعني حاسه ان هو المفروض يبقى فيه more awareness عن ان في اصلا center mental health في الجامعه، بلس ان يعني في ناس مثلا مره كان في حد بيتكلم في ان هو I cannot trust ان انا اروح اتكلم مع حد غريب واحكي له مشاكلي، انا مش عارف الحد ده هيجادج مي ولا لا، او الحد ده هيطلع اسراري بره ولا لا. فحاسه ان احنا المفروض شويه المنتل هيلث سنتر يركزوا على ان هم يطمنوا الستودنتس انه لا احنا هنسمع and you guys won't be judged أو أسراركم مش هتطلع بره.
We have a lot of campaigns for students and the AUC community as a whole in order to try to destigmatize mental health. We have Mental Health Week coming from October 8 to 12 in 2 weeks, and we're partnering as well with many stakeholders across campus, such as the Psych Department, the Psych Student Association, and we're going to try as much as possible, to campaign around mental health, to give a lot of educational workshops, at the same time have a booth in the plaza, advertise green, which is the mental health color, and this will help a lot in raising awareness about the importance of mental health.
Helping a community of thousands of students pushed us to ask about the capabilities of the Mental Health Center.
We have a team of around 5 full-time psychologists and psychiatrists, and the psychologists get supervision as well from the chief clinical counselor, which is a psychiatrist. And we also have a lot of SLAs, or part-time counselors, that come in and meet with students as well, around 7 or 8 of them. So based on our annual report for last year, which runs from June 1st, 2022 till May 31st, 2023, we did around 5,000 appointments, serving a unique number of approximately 900 students, which is around 13% of the total AUC student body. This is a large number, but it's comparable to numbers seen also in the States and in other prominent institutions where the counseling centers usually serve 10 to 15% of the student body.
The center helped hundreds of students for years. Nevertheless, Zena has a specific story.
One of my professors knew I was going through a hard time, so they referred me to the student center. And I booked an appointment, and I went for a couple of therapy sessions. And they provided the support I needed to become better focused and to have a better mood. And they helped me develop skills and tools in order to become stronger and in order to cope with everything that was happening in my life. I used to go every week, and then when Corona hit, I used to do online sessions as well because I'm not from in Cairo. So they were very accessible, and they were very flexible, and they helped accommodate where I was and my busy schedule in uni.
But when students should think about seeking help for themselves or their colleagues?
If a person has noticed inability to function, decreased socialization, so if his social life, his academic life, his sleep or her sense of pleasure are affected, these are important indications that they need to seek help. So generally we have to address it if the functioning is affected or the sense of pleasure, the quality of life itself is affected. If a friend of yours is suffering or having any mental health problem, then I would advise you to be patient. Don't jump to conclusions or assume that you understand it. Don't push them so much to seek help. Of course, you should encourage them to seek help, but make them do it when they're ready. Encourage them to do it without rushing them, because they might, if you push someone or pressure someone, they can give a total opposite reaction.
AUC's vision focuses on mental health as part of its plan to ensure a positive and transformative experience for all students. Noha Saad, AUCTV, Cairo.